So to start my assessment, I'll introduce myself to the patient. Hi, my name is Hannah. I'll be your nurse today.
Hello.
I'll also perform hand hygiene before going into the room. I'm going to start the assessment by doing a neurological exam, making sure that he's alert and oriented and not in any sort of emotional distress. Can you tell me your name?
Nathan.
Can you tell me where you are?
At home.
And can you tell me what year it is?
2020.
Okay. Now I'll move on and check his skin of his face to make sure there's no rashes or lesions, making sure that there's nothing wrong in his scalp, and going ahead and testing his hearing by making sure I can hear the hair running through my fingers.
I can.
And I'll go ahead and look at his ears to make sure they're symmetrical on both sides and that there's no inflammation or anything on the outside of them. And I'll move on to his face, making sure that there's no facial drooping or any signs of any sort of problems. I'll go ahead and get him to raise his eyebrows. Okay, and puff out his cheeks. Okay, and I'll go ahead and look at his eyes, making sure that there's no redness or irritation or any sort of yellowing to his sclera. And I'll go ahead and check to see if his pupils accommodate to light and to see if he can follow my finger. Making sure that his eyes look good on both sides. I'll go ahead and look at his nose, checking inside of his nose to see if I see any lesions or any irritation. And I'll also go ahead and look at his mouth, checking to see if there's lesions or irritation, making sure that his teeth look normal and that his mucous membranes are nice and pink and moist. I'll also assess his gag reflex using a tongue depressor. And I'll make sure that he can stick out his tongue, move it from side to side, that I can palpate the clenching of his jaw on both sides. And moving on to his neck, I'll go ahead and see if I can palpate his carotids, that they're normal and equal on both sides +2. I'll palpate for his thyroid by getting him to swallow. And I'll palpate for any lymph nodes. And I'll also check for a jugular vein distension, which I cannot see. And I'll get him to shrug his shoulders against resistance and push against my hand for resistance on his face. Okay, moving on to his chest area, I'll go ahead and auscultate for his heart sounds. Listening to the aortic, pulmonic, Erb's point, mitral, and the apex, listening for S1 and S2 sounds. And I'll listen to his breath sounds, making sure to document the rate and rhythm of his heart rate and the rate and rhythm of his breath sounds to make sure that he's not using any accessory muscles and that everything is normal, and I'll record that. I'll also go ahead and take a look at his arms and auscultate his blood pressure, making sure to line the cuff up with his brachial artery and recording that. And I'll also check his radial pulses on both sides to make sure that they're nice and equal, and check his capillary refill. I'll also, while I'm at his arms, go ahead and do his tricep reflex to see if his arm extends, and his bicep reflex to see if his arm flexes on both sides. And I'll also go ahead and look at his skin all over, especially his chest and his back while I'm auscultating, to make sure there's no lesions, to make sure that his skin is nice and dry and not clammy or cold, and make sure that he has good skin turgor and that he's not dehydrated. I'll also move on to his belly, listen to his bowel sounds in all 4 quadrants, at least listening for 1 minute to make sure they're active. Then I'll go ahead and ask him some questions about his bowel functions, and if you remember when the last time you had a bowel movement was.
This morning.
And if it was normal, formed.
It was.
And was there any blood?
No.
And ask about his urinary function, if he has been peeing normally.
I have.
if his pee was clear and not cloudy,
It was.
and if there was any burning or itching. Okay. And I'll move on to his legs. Well, I'll be looking at his skin to make sure there's no edema and assessing for any skin abnormalities again. I'll check his popliteal pulses on both sides, making sure they're +2. And go ahead and check his patellar reflex right here to see if his leg extends. Okay. And move down to his feet, check his posterior tibial pulse, and on both sides, making sure it's +2. And while I'm here, check his Achilles reflex to see if this has plantar flexion. Check his pedal pulses on both sides to make sure they're equal and normal, +2. And check for his Babitsky reflex and make sure that is negative, because it should be negative in adults.